Joining us on the show right now is a Nigerian-British medical director with extensive experience in the healthcare sector and the CEO of MobiHealth International, Dr. Funmi Adewara. She will be telling us more about the MobiHealth International. Welcome to the show, Doctor. So tell us a bit about MobiHealth International and exactly what inspired the starting. Why did you think it was necessary to have this kind of service?
So thank you very much for having me here. Good morning, viewers. So MobiHealth is a multi-award-winning integrated telemedicine company, and it started in November 2017 with the intention of bridging the gap in the healthcare space. As you probably know, users in Nigeria and Africa have difficulties accessing quality care. As a matter of fact, more than 95% of people in Africa lack access to basic health care. And it's worse for those who live in rural, hard-to-reach areas who don't have access to traditional healthcare facilities. They live very far away. So our solution is an application that allows users in Nigeria and Africa to connect with doctors seamlessly on their mobile device, their computers, and walk-in clinics. The walk-in clinics come with solar power. They come with internet connection, and they have these artificial intelligence devices that allows doctors to take their real-time vital signs and provide quality care to them. So this is the innovation that we have been driving for the past 5 years, but we launched commercially January 2020, and we've been able to impact lives across Nigeria.
So I'd like you to break it down for the benefits of people watching. Telemedicine, what's it about in very clear terms? How do you access it? What is it? What do you need to be able to get?
So telemedicine simply means using modern-day technology to provide clinical care from a distance. You know, when you're ill, you want to go to the hospital to see a doctor. It then takes the history, diagnose you, prescribe, and then you have your test done. But now with technology, you can access doctors more conveniently, seamlessly from your home. You're already doing mobile banking. Okay. You're doing flight booking. Okay. So similarly, you just go on your application.
On your phone,
or your laptop, or iPad. Okay. And for those in rural areas who don't have access to these devices, they can simply walk into a telemedicine clinic. Okay. And somebody there will connect them on the screen to a doctor remotely. Wow. And the doctor can be anywhere in Nigeria. The patient may be in Kogi State, and the doctor may be in Lagos. And you'll be able to access the care. 65% to 70% of cases can be solved remotely, online.
So how do you get the vitals done?
So we have these devices that have digital stethoscope, pulse oximeter, and point-of-care ultrasound. So I can actually scan a pregnant woman in the village, and the doctor can see them from anywhere in the world, an iPad and a probe. So technology is really changing the way we can access healthcare. And it's just unimaginable that every 2 minutes, as we're sitting here now, a child dies needlessly from complications of malaria, and that things that can be resolved through telemedicine, which is instant, is as easy as me just entering anywhere and going with an iPad or phone, and the patient is able to connect with a doctor instantly.
Amazing.
Recently, your partnership with Afreximbank, that's MobiHealth, and Afreximbank partnership. Yeah. What exactly is the objective of your collaboration with them?
So we've been very fortunate to be supported by reputable institutions like the Gates Foundation, the World Bank, Africa Development Bank, Africa Investment Forum. The latest one is the Afreximbank, and we just closed a funding round with them. And the intention is, it's a project preparation facility, but they're also providing funding for us for the entire duration of our project. And that is to facilitate access to quality healthcare. Similarly, just to consolidate our presence in the Nigerian market, we want to roll out many telemedicine clinics so that within every mile that you walk in Nigeria, whether or not you have smartphone or device, you can access this care. So it's about our Pan-African expansion plan.
Yeah. Okay.
Can you talk to us about the participation of MobiHealth and GITEX 2024 in Morocco?
Yeah, so we were one of the startups that were selected to participate and showcase our innovation at the largest, that's GITEX, in GITEX Africa 2024 at Morocco. Yeah, in Morocco. And it was to showcase our innovation. And GITEX is the largest technology and startup exhibition. And so it was a tremendous opportunity for us to do that. And we were able to to meet with different stakeholders along the value chain. So we met with fellow tech entrepreneurs. So there's kind of ecosystem partnership. So for us, it's an integrated model. It's not just that you can see a doctor on our platform, but you can also get your prescription. So access to genuine medication. We do delivery of the medication to you at your convenient place. If you need a test, after the doctor has seen you online, we have partnership with laboratories. So we send a request and the lab then sends a confirmation to you. You don't need to go and wait before you get your test done. Once the result is ready, it's on your electronic medical record. So you have your medical record on the palm of your hand. And if there's any need for you to go to the hospital for further care, then we can refer you to the hospital. But it's only about 30% of cases that you would need to go to the hospital. So 70% of the time you don't need to, and you have these devices that can easily give you access to care. So that GITEX was an opportunity to showcase this, but also to meet with other collaborators. So in terms of market access, we're partnering with fintech companies, we're partnering with technology companies, telcos, we're partnering with diagnostic companies, and the rest of them. Yeah, so it was a very good opportunity indeed.
Can you share some of the success stories? Because in Nigeria, they say Ojulo Roba, people like to have the doctors come.
Yes.
It's one thing for you to talk to one of them.
Yes.
But I have a friend recently she had appendicitis, and she had some kind of surgery done, but the doctor kept saying, talking to her remotely, because he actually had left the country, but after the surgeon had done, she needed a proper doctor to just check her. He was out of the country, was on Hajj. She kept calling and he kept saying, okay, I'm speaking to the nurses, but she wasn't satisfied. She needed somebody to come and examine her. So in Africa, until we see the doctor, we don't feel we've been checked. So what kind of success have you?
So we have quite a lot of success stories. Telemedicine can be applicable across the whole value chain of the healthcare system, from primary, secondary, or tertiary care. We have quite a number of success stories. So in November 2020, we got a grant from Gates Foundation to demonstrate that telemedicine can actually be useful for those in rural, hard-to-reach areas.
And it's working.
And it's working. So we have success stories like in Ekpe, for instance. It's a primary health center. They have a limited number of doctors. So when we started, just like you said, most people always say, oh, I want to make sure that the doctor can feel me. How will he know what is wrong with me if he can't feel me? So when we went there, they were like, oh, Telemundo. Their name is Telemundo. We don't think it's going to work. But they were very surprised, and pleasantly so. According to the testimonial we have, it reduced the traffic, the congestion in the PHCs. And some of those patients, interestingly, even the uneducated ones, will come into the clinic. They will prefer to see the online doctor. And there's a synergy between what the online doctor is doing and the rest of the team, whether it's the nurses, the pharmacists on ground. And they said that it's transformed Ekpe telemedicine, Ekpe PHC to a...
This Ekpe here?
Yes. So we have a very live, and we've deployed more than 20 telemedicine clinics across Nigeria. So we are in Kogi State, in Isonlu, in Kogi State. In that place, they didn't have any doctor. We went there. It was a community health center, beautifully built by PZ Cousin, but there was no doctor there. So they just shut it down. And the former Minister for Health, Professor Lambo, said, Funmi, can you please come and just change this place for me, put telemedicine clinic. And we put telemedicine clinic. And then they started to see, we saw patients who have blood pressure of 200 and didn't know that they were...
I was going to ask, when you talked about the Afreximbank funding, what was it providing for the people? Because most of the people might not even have,
the gadgets
to go.
Yeah.
That's exactly where I was going, because most of these people in the rural areas don't have gadgets, and even if they have, there's no network.
Yes. So we built, that's what we've done very well, and that's what really sets us apart from others. We're very intentional in our approach. So the telemedicine clinics are particularly designed for those who don't have access to digital tools, who don't have the digital skill. So putting them there, we're creating employment, because we're employing the youth who have digital skills in those communities. They man the telemedicine. You know the days of computer center? So it's similar to computer center. So you just go in. In this case, you're not even the one operating it. You meet somebody there, and mama comes in and says, I have chest pain, or I'm not feeling well. And then the person registers mama on the computer and connects her instantly to a doctor. Then the doctor comes on the screen, mama, and they're able to communicate with the patient in local languages. So we have doctors who speak different languages, and then they communicate with her, then do the diagnosis, prescribe. In the telemedicine clinic, we make sure that they're designed in a way that they have solar power. So it addresses the infrastructure problem.
Okay.
They have internet connection. And then they have the point of care diagnostics where doctor can listen to your heart remotely. They can do a scan and they can check your pulse and all the rest and do your blood pressure.
Right.
As well as medicines within those centers. So they don't have to go anywhere else. So essential
Get the
medicines
medication.
are there. Rapid test kit. I can check if you have malaria, UTI on site. And this is transforming lives. So we have more than 20 telemedicine clinics across Nigeria. Back to your question about how Afrexim funding is going to impact. So we want to roll out hundreds of telemedicine clinics using existing infrastructure. So right now we partner with banks, so Union Bank, Wema Bank, and the rest of them. We partner with health insurance companies. Health insurance companies have a lot to benefit from telemedicine because for each of the time that an enrollee goes to the hospital, they spend nothing less than 5,000 naira per consultation, sometimes up to 25,000, depending on the cadre of the hospital. With telemedicine, we are so affordable. It's 5,000 naira for a family of 6 a year to access care. That's about 90% cost savings for you. And then it also saves you indirect cost of travel, the inconvenience, the waiting time. So it's
about the medication.
Yeah. So if you're a health insurer, if you're an insurance company or you're an enrollee, that means that if we partner with the health insurance company, it just feeds into the existing workflow.
Yeah.
So once the doctor has seen you, they will send the prescription to the network of their pharmacy. Yes.
And we know how that works. Sometimes you have an ailment that the HTMO cannot cover.
Yeah.
What then happens?
Okay, so if that is the case, our platform allows you to buy the medicine we have a network of pharmacies, and the cost is significantly less than what you pay on the retail pharmacy, so about 30% less. We have partnership with Drugstock. We're partnering with Pharmacy, a similar health tech company. So technology can really make unsustainable healthcare models sustainable.
We're wrapping up very soon, but I need to find out that does your service also connect Nigerians to medical practitioners outside the country?
That's right. So I think that's one of our very unique propositions. You know, currently Nigeria has less than 10% of the doctors that we need for a population of over 200 million people. WHO says we need 1 to 600 per population, 1 doctor to 600 people. We currently have 1 to 10,000. I left the country nearly 20 years ago, about 18 years ago. There are different reasons why people leave, and I'm sure you're all very well aware of the push and the pull factors. But telemedicine, we're using our platform to bring back those diasporas. Over 50,000 Nigerian doctors are scattered all over the world. And so through our platform, they are giving back to the continent. It's not free. So we have the one I told you about, 5,000 naira plan is a basic plan. We also have the premium. And that is targeting Nigerians and Africans in the diaspora who have families back home, and they pay for subscription for them. They often want a second opinion from a doctor in the UK, in the US. So through our platform, they can access this service.
Connect them to them.
Yeah, so we have thousands of diaspora doctors on our platform.
I hate hospitals. You're recommending I do
Telemedicine.
Telemedicine.
Absolutely.
Right.
So that white coat hypertension is not there anymore.
Yeah.
And importantly, you know, people wait until they're very ill before they go to the hospital.
Yeah.
Some of the times, these women in the marketplace, that's their survival. They don't want to leave their store because they don't want to lose the daily income. But when they know that there's a telemedicine clinic just around this corner here, they go in there. Or when you know you can see a doctor instantly on your phone, you're likely to seek care.
Wrap up now. Thank you so much. I think, it's really impressive to see the work you've done, and wishing you all the best. You only have 20, but we're hoping you can get more across the nation.
Absolutely.
It's important so that everybody have access to healthcare.
Thank you.
Well done, Dr.
Thank you.
Well done.